Hello everyone, welcome back to my channel. Today in this video I'm going to talk about the anatomy of pharynx. So understanding its concept, we will first know that what we are going to learn in the video. We will understand the introduction of the pharynx, its boundaries, the difference between naso, oro and laryngopharynx, that is three divisions of the pharynx, their locations and communications, pharyngeal isthmus, features and applied aspects we are going to learn in this video. So now, as here shown here in this image, this is the nasopharynx, this is the oropharynx, and this is the laryngopharynx as mentioned. Now this is the laryngopharynx. This is the nasal cavity in front, hard palate, soft palate, tongue and the trachea, which we will be including in the communications in further video. So yeah, it is a fibromuscular tube. It is a common channel between food and air. Their location is behind cavities of nose, mouth and larynx. Their dimension as written, length is 14 cm approximately, and width at pharyngo-esophageal junction is 1.5 cm. If we talk about the boundaries of the pharynx, then superiorly it is surrounded by the base of the skull, inferiorly continuous with the esophagus at the level of lower border of cricoid cartilage, posteriorly with the prevertebral fascia, anteriorly to the cavities of nose, mouth and larynx, and laterally to the neurovascular bundle of neck, styloid process. Now the nasopharynx. So nasopharynx is situated behind choanae, that is posterior nasal apertures. Communication, so it is surrounded anteriorly with the nasal cavity and inferiorly with the oropharynx. So posteriorly with the bone, inferiorly with the oropharynx. Now about the nasopharyngeal isthmus, which is an important part, which is situated anteriorly by the soft palate and posteriorly by the posterior wall of pharynx. So it is basically an opening which is bounded anteriorly by soft palate and posteriorly by wall of pharynx. Now nasopharyngeal tonsils. So it has tonsils called adenoids. Now nasopharyngeal bursa, which is also known as pouch of lushcka, which is important in questions as it is a mucus diverticulum which extends upward into the substance of pharyngeal tonsil from its apex. It is developed due to adhesions of notochord. So yeah, now auditory tube opening is also present here in nasopharyngeal region only, that is also known as eustachian tube. Now it has salpingopharyngeal fold, salpingopalatine fold and pharyngeal recesses. So salpingopalatine fold is a mucus fold which extends downward to the soft palate and contains levator palatine muscles. Salpingopharyngeal fold contains salpingopharyngeus muscle. And a pharyngeal recess, which is known as fossa of Rosenmüller, is a deep depression behind the eustachian tube opening. Now understanding the concept of oropharynx. So oropharynx, oropharyngeal isthmus, it is a communicating channel between oropharynx and oral cavity. It has boundaries which is anteriorly, that is above by the soft palate, below that is inferiorly by the dorsal surface of posterior 1/3 of the tongue. As you can see, posterior 1/3 of the tongue, say it is lined below. Laterally by the palatoglossal arc as shown here. So oropharyngeal isthmus is important as it is closed during deglutition, which is an important part in swallowing. It has palatine tonsils, lingual tonsil, glossoepiglottic fold, palatopharyngeal arc. Now the palatoglossal arc is known as anterior facial pillar, and posterior pillar is the. Now understanding the laryngopharynx, that is also known as hypopharynx. It contains the pyriform fossa, which is also known as the smuggler's fossa. It has pharyngeal wall, consists of 4 layers. Contains of mucous membrane, pharyngobasilar fascia, muscle layer, buccopharyngeal fascia. Now the important term in this is the Waldeus ring, which is the combination of 4 tonsils.